Hello, dear Presidium colleagues. Thank you for the opportunity to present a report here, Digital Patterns in Mammographic Studies for Non-Invasive Diagnostic of Morphological Types of Newly Formed Breast Glands. Mammography is one of the diagnostic methods as well as the only screening method for breast cancer. Mammography as a diagnostic test is difficult to interpret and often leads to overdiagnosis. This is especially often observed against the background of dense mammographic glands, which requires additional diagnostic examination by ultrasound diagnostic. The international scale by RATS is used to standardize mammography results. It is the main tool for assessing the risk of breast cancer as well as the basis for the appointment of additional examination, including a biopsy. A trephine biopsy is a rather painful procedure for the patient. It is sometimes carried out due to overdiagnosis. And also, despite several attempts to take the material, it does not always reflect the tumor material completely. Today, for successful treatment of breast cancer, in addition to early diagnosis, accurate results of tumor classification by molecular type and histological type based on biopsy are required. A formation that is suspicious of malignancy is very important to fully evaluate in volume. This is due to intratumoral heterogeneity. It reflects the phylogenesis of the tumor and the development of individual cell lines and its structure over time. Just for assessment of intratumoral heterogeneity in the future, such a method as radiomics can help us. Radiomics is the process of extracting masks of medical diagnostic image of digital patterns, which are characterized by quantitative indicators and which are further used to build classifiers using machine learning methods. Radiomics is non-invasive and low cost and may become a potentially routine procedure in the future. To use radiomics in the future, we only need an image segmentation tool, as well as a set of optimal classifiers for a particular task. Using the example of this work, such a task may be to determine the morphological and histological type of the tumor, which can increase the accuracy of diagnosis as well as reduce the number of invasive procedures, especially in case where these procedures are not needed. So the aim of the work was to study the possibility of radiomics for classifying histological types of breast cancer on mammographic images. Histological types for each image were determined using Moscow City Cancer Register. We analyzed 62 digital mammographic studies in standard craniocaudal and mediolateral projections of women from 38 to 75 years old. Digitized analog studies were excluded, as well as studies of patients after mastectomy or resections. Correspondence of the data of radiation diagnostic and data from the cancer register was checked for a time interval of no more than 1 month between them. Graphic markup was carried by students of medical university under the guidance of radiologists of the Center of Diagnostic and Telemedicine in the IMEG program. The tool for extracting mask from doctors' markup was developed in-house by the center in Python. The balance classes and the distribution of mask by histological subtypes is presented on the slide. Extraction of radiomics features was carried out with the standard p-radiomics tool. The slide shows an example of obtaining mask by graphic marking by radiologist. Note that the outlines used an oval shape to speed up the layout. For each such mask, the p-radiomics tool extracted 86 radiomics features that are used for planar images. Feature groups are presented on the slide. Here is an example where all algorithms correctly identify the histological type of two studies, the lobular carcinoma and invasive ductal carcinoma. From the position of radiologists, both formation would be described as a limited area of high density parenchyma with fuzzy contours. Here, an example of a false positive result: the algorithm incorrectly determined the histological type, namely invasive carcinoma, within the region of interest. So let's move on to the conclusions. The work shows the radiomics makes it possible to establish a relationship between textural features and the histological type of breast cancer, which may be clinically applicable in the future, taking into account the presence of class imbalance as well as inaccurate graphic marking in the form of ovals, into which a lot of probably unchanged parenchyma falls. It is worth continuing research in this direction, aiming at improving the quality of segmentation and data augmentation. Here are references, and I'm ready to answer all of your questions.